So we've talked about, so we have 3 areas so far. We have the base of the skull in the back, right where your neck meets your skull. We have above the eyebrow, or in the eyebrow area, the upper eyelid. We have the temporal area where your sideburns are. Is there any other areas?
And then there's the nose. So
Okay.
a lot of people will have nerves, variable compression in the nose from turbinates, which are part of...
They're outcroppings that
They're like the humidifier.
humidify the air
Yeah,
that goes to your nose.
exactly.
We've talked about actually on a rhinoplasty podcast,
We
so
talked
you
about
should
what
definitely check that
turbinates are.
out. Beauty and the Surgeon.
There you go. And sometimes your septal deviation, which you can...
Right.
So that's the
Yeah.
central portion of your nose.
The
that can be
tinpole
bent.
of the nose, yeah.
And so you can get compression there. So that is the other approach that we do to disrupt those areas of compression. So you'll either do a septoplasty, where you're decompressing and straightening the septum, or excuse me, a turbinectomy, where you actually take out the turbinate. But to be honest with you, what I usually do for those patients is I will send them to an ENT surgeon.
I was just going to ask if you work in conjunction with
right,
ENTs.
because I've done those surgeries. I do those surgeries, but these are not aesthetic things. These are functional things, and will a lot of times incorporate several different people who work in the nose. Do a lot of nose.
Yeah, we've talked about it before. I mean, their primary job is nasal airways
Exactly.
and sinuses, so it doesn't make sense that you wouldn't send it to them, especially for someone who needs a functional improvement.
Exactly.
It has nothing to do with aesthetics.